Alright, today we have another high-yield USMLE CK question. One that Nbme love to repeat, but with a small twist. The case today is about a young woman with the chronic worsening hand pain, and the patient work on the computer. Hearing this mislead you toward carpal tunnel syndrome, but the patient have morning stiffness lasting for 1 hour and more. This is a clue for an inflammatory condition. Another clue, in this case, the patient have type 1 diabetes. This is another clue for autoimmune history. So, the X-ray showing a joint space narrowing and osteopenia, and the antibody panel detect a positive titers against citrullinated peptide. So, this is a classic rheumatoid arthritis patient. So, when you see a bilateral hand pain and spare the distal interphalangeal joint, and positive titer against citrullinated peptide. This is absolutely a rheumatoid arthritis. Now, which of the following is the most likely antibody targeted in this patient? Now, here where questions get tricky because he giving us anti-citrullinated peptide in the questions. What another antibody targeted the patient have rheumatoid arthritis? The antibody in the patient have rheumatoid arthritis also targeted a FC portion of IgG. This is called a rheumatoid factor. When the IgM targeted the FC portion of the IgG, it's called rheumatoid factor. So the right answer here is E, immunoglobulin. Why the other option is wrong? Because centromere antibody seen in limited scleroderma, Class syndrome, not rheumatoid arthritis. Double-stranded DNA, this is a systemic lupus erythematosus antibody, usually with the kidney disease. Histone, this is drug-induced lupus from hydrolyzine or proconamate. HLA-B27, seen in ankylosing spondylitis and seronegative spondyloarthropathies. U1 ribonucleoprotein, this is classic for mixed connective tissue disease. So here, the right answer is immunoglobulin, the closest representation of the rheumatoid factor. Now here, a key fact about rheumatoid factor. Rheumatoid factor is not sensitive, not specific test for rheumatoid arthritis, but is sensitive. Can seen in 80% of rheumatoid patients and can see in 80 to 90% in Sjogren syndrome. It is less specific than anti-citrullinated peptide, but is still commonly tested. Now you must see this case appear in different ways. A long-standing rheumatoid patient with sudden worsening symptom. Think about Felty syndrome, when rheumatoid arthritis plus neutropenia plus splenomegaly. And case may appear with rheumatoid patient with neck pain. Think about atalantoaxial subluxation. Now, once you diagnose rheumatoid patient, the next step is start DMARD. Methotrexate is the first line treatment. Check liver function and pregnancy before starting methotrexate. Other options, hydroxychloroquine for mild rheumatoid arthritis patient. Sulfasalazine is the best drug for rheumatoid patient in pregnancy. Biological agent like TNF inhibitor, infliximab, and other can use this in severe cases. Took this clinical peril, NSAID and steroid help symptom but do not stop joint damage. So let's look in this. Rheumatoid arthritis patient have chronic hand pain and autoimmune background and joint space narrowing, and the joint pain is symmetrical. Anti-citrullinated peptide is the best test for rheumatoid arthritis patient. Again, anti-citrullinated peptide is the best test for rheumatoid arthritis patient, better than rheumatoid factor, because anti-citrullinated peptide is the specific test. If anti-citrullinated peptide isn't available, pick up immunoglobulin or rheumatoid factor in choices. Early treatment with methotrexate will prevent the joint destruction. So, now we finish the today questions. Have you seen this exact question in your practice exam? Tell me in the comments. Don't forget likes, subscribe, and hit the bells icon for more USMLE questions, breakdowns,